What makes a great surgeon? Is it the speed with which a surgeon operates? Is it the ability to handle complicated cases? Or is it the ability to have zero to minimal complications? There are many qualities that can define a great surgeon. But great surgeons are not born, they are built by hard work, endurance, patience, knowledge, practice, skill, empathy, and a lot more. Today, we are presenting to you the 15 commandments to achieve greatness as a cataract surgeon. As you take your first steps to begin your journey into the world of cataract surgery, these principles, these basic rules will guide you to be the best version of yourself. We have no financial interests to disclose for our presentation today. Commandment number 1. Know thyself. Before you are given an opportunity to handle your first case, your first patient, it is your duty to take a journey within. Learn about yourself. What is your interpupillary distance to be set on the microscope? Work under the microscope to develop your depth perception and stereopsis. Put in hours and hours in the wet lab to become comfortable. And know your temperament as a person and as a surgeon. The second commandment, know thy patient. In every cataract surgery that you do, the diagnosis may be the same, but every patient is absolutely different. Remember, God is in the details. Therefore, you should be meticulous to learn every little detail about the patient you are about to operate. Know thy machines. With the technology progressing at a rapid pace, you need to understand the functioning, the phaco-dynamics of the machine you are going to use, how to use the foot pedal of your microscope, and what settings would work for a beginner and why. The fourth commandment tells you that thou shalt do no harm. Remember the Hippocratic Oath. Always aim to do what is best for the patient. If you are struggling in a case, do not let your ego or greed come in the way of asking for help. Trust your mentor to navigate you through challenging situations. Commandment number 5. Observe, observe, and observe. Learn to train your senses to observe keenly. Observe how your mentor, your colleagues operate, how they move their hands, how they think, how they anticipate, and how they remain calm in challenging situations. You sharpen your observation skills and you shorten your learning curve. While in physics, you read that every action has an equal and opposite reaction. In surgery, your every action has an exponential reaction. You make a wrong side port, iris will keep troubling you. A small rhexis, nucleus just won't come out. Improper sculpting, the entire case becomes difficult. So you must understand that every step in surgery is equally important. Commandment number 7. At the start of your cataract journey, you can make your cases much easier by following this simple commandment. You are doing an SICS, make a slightly larger incision. Aim for a slightly larger rhexis in your phacoemulsification cases initially. It just makes things much easier for you. Stop, reassess, and restart. In case you land up with a complication, most important thing is not to panic. Every surgeon will have complications. It is important to avoid complications, but more important to learn to manage them. So remain calm, take a deep breath, assess your options, see if you need help, and then restart when you have a plan in mind. Thou shalt not touch what is not seen. As a beginner, it is important to become a safe surgeon first before you delve into adventure. Always make sure you visualize where your instruments are going. Don't do anything blindly. If it's a small pupil, use pupil expanding devices. If the pupil has become smaller during surgery, hand over the case to your mentor. Do not fish for remaining nucleus pieces or cortex without visualization. Commandment number 10. Be kind, rewind, and play it on a loop. We are lucky to be in an age where technological advancements have given us access to multiple sources of learning. You have thousands of surgical videos which are available online freely for you to watch repeatedly, learn different tips and tricks, different techniques from different surgeons. This commandment tells you to do the same, but visualize yourself doing each step meticulously. Play each step of the surgery 100 times in your mind so that you have already performed the surgery 100 times in your imagination. Visualization is a powerful tool that can help you to reduce your learning curves. We are going to make a lot of mistakes as a surgeon, but every mistake that we make will have its consequences for the patient and for us. So what I tell my junior fellows is to learn from not only their own mistakes, but learn more from mistakes made by others. This will help you to reduce your errors, you would become a safer surgeon, and you will learn how to handle complications better. Detached attachment. Thou shalt take care of oneself. The first time I had a posterior capsular rupture, I couldn't sleep at night. As surgeons, our mental health takes a toll, especially if we deeply care for every patient that comes to us. Remember, as a young surgeon, care for every patient, but don't forget yourself. Thou shalt not be blinded by pride. Very often, as we start becoming a little confident, we forget that a surgeon needs to be a lifelong learner. If you are ever in trouble, swallow your pride. Think about the patient. Is there someone who can handle this situation better? A mentor or a colleague? If yes, do not hesitate to call for help. In the end, patient's eye matters more than everything else. Thou shalt not be afraid. You are a surgeon now. Be bold. Be fearless. Remember, the only surgeon who never has a complication is the one who never operates. The last commandment is probably the most important one. It simply states, always put patient first. Consider it as a great privilege and honor that your patient has chosen you as their operating surgeon. Forget your ego, forget your apprehensions. Bring your complete focus to the operating table, because that's what every patient deserves. Remember, you might do thousands of surgeries in your career, but for the patient, it is only one of their two eyes that they are getting operated. Therefore, always put patient first. If you follow these 15 commandments from day one of your cataract surgical journey, I assure you that you will achieve excellence in cataract surgery with a much shorter learning curve. These 15 principles, these 15 rules will make your journey fulfilling, allowing you to accomplish being a great surgeon that you deserve to be. Thank you for your patient listening.